హాయ్ వెల్కమ్ టు కేర్ సంవాద్ విత్ మీ మిర్చి హేమంత్ అండ్ ఈరోజు నాతో పాటు ఉన్నారు స్పైన్ సమస్యల గురించి మాట్లాడడానికి డాక్టర్ రణధీర్ కుమార్ సార్. వెల్కమ్ టు కేర్ సంవాద్. ఫస్ట్లీ కుడ్ యూ షేర్ with us what inspired you to become a neurosurgery or a spine surgeon, this journey, sir?
Hemant, there never always inspiration. Sometimes situation, sometimes incidents leads to some profession changes. I'll start my story when I was doing my Master of Surgery.
Okay.
Before any super specialization, you have to do the surgery. So I was doing the surgery, it was a final year, and I was posted in, that time I had not decided which branch I will take for super specialty, either neurosurgery, gastrosurgery, absolutely no. I was just doing my surgery course. So on the final year, I was posted with my friend in the cardiac department. That was not cardiac, cardiothoracic. So I was posted in the thoracic department. In the thoracic department, most of the patient of thorax is what? In India, most common disease is TB, tuberculosis.
Correct.
So 30-40 patients were there every day. We have to do the tube changing, dressings, and that time we are not using proper mask. Student time, night, not proper food. So what happened? I got infected, right? That not known. So what happened, slowly I started pain in my neck, in the back region. It was going because exam period was there. So I ignored. And you know, doctors are the worst patients. You know, no? That's true things.
Yeah.
Start from myself. So what happened, appeared for the exam, cleared my exam, MS. And after that, what happened, the pain severely increased. And then somebody advised, why not to get X-ray? X-ray was nothing. So advised for the MRI. When I got the MRI, I had a severe spinal tuberculosis at dorsal segment is there. And such a severe, it was worse to develop my leg weakness or paraplegia.
What?
Yeah. So that was the time I thought, and I was mobile, moving here and there. Then they advised to go for the surgery. And to who is going to do surgery? Orthopedician is confused, neurosurgeon is confused. He's telling no, the complication chances is so much he will lose his leg. So that was a 3 months time I was on the bed. Okay, after passing my exam, I was thinking, then start reading what is this spine, other thing. And that the era where I entered into my mind, okay, let me come out of this problem, I'll join the neurosurgery. And I came out with the medicines. Right now with that, after 6 months, I have taken the rest, started studying again, and joined the neurosurgery in Delhi. So that is my incidence story.
And now any patient who is like you will fix them.
Yeah, absolutely.
Oh,
That's
wow.
why I made for that.
Wow.
So that was a story, small story, and real story to me. So inspiration, yeah, always inspiration. But that is the incidence to me is there on the words where I could on the wheelchair, lifelong on the wheelchair.
So your incidents are your inspirations.
Yes, 100%, Hemant. 100%.
Sir, you've had international fellowships in endoscopic surgery, neuro intervention, etc., sir. I wanted to know how these global experiences influenced your approach towards patient care in India.
Sure. Hemant, the meaning of fellowship is not merely to learn the trick and technique of surgery or neurosurgery. What my fellowship is there, I learned what I learned from my whole of this fellowship, work culture, ethics. Right now, the patient's-doctor relationship. Third things, safety of the surgery, the infection control safety. You know, in there I have seen before at work culture, 7 o'clock if a hospital start, right from topmost neurosurgeon to junior most is available in the OT. 7 means 7. 7:15 patient is inside the OT, and the OT in charge nurse will be one paper like boxes. Patient name, this John, tick. This anesthesia is available, tick. This one is tick. This one is tick. Which site to be operated, mark, tick. Blood arranged, arrow, not all the instrumentation. So whole box is ticked, and then start intubations. That is called the timeout procedures. So this all thing after there I start following in the India. Third things, safety. This is the safety. There I have learned in India what we have so much population is there. Who is doing what? We are hardly bothered about what is the results. There in US or Germany, what I learned, they have a simulations lab. They have the brain labs where suppose one brain tumor is there, that they develop one module, 3D module, and they operate before the actual surgery like it's a flying aircraft in the simulations. so that you will go to the actual flying, you can do the without any sort of the problem. So they operate it before that and after. So these all things I learned and what I'm applying apart with the tricks of the neurosurgery or spine surgery. Okay.
So they say on one side there is so much of technology, everybody becoming software engineers, AI engineers, chat GPT engineers, etc., etc. However, on the other side, if you see, this cervical and lumbar spine problems are becoming like very common today. What lifestyle or age-related factors are driving these?
First of all, I like to modify your question.
Right.
What is this spine disease? Everybody thinks where to go. Suppose any of or your colleague, yeah, spinal issues undi, ye doctor cheyali, orthopedic doctor, neurologist, neurosurgeon, still confusion undi. That's still lot of confusion. See, first thing I'm tell, the brain and this spinal cord, this is called central nervous system, right? It is just covering of the brain is the skull, and the covering of this spinal cord is the vertebra or the spine. That's divided into the cervical, dorsal and lumbar spine is there. So basically this is the central nervous system. God has given only one time, the brain and spinal cord. If once it's damaged or any deficit, it's not going to recover. That has to keep in the very, very mind. No skin, bone, everything will regenerate. Nerve never regenerates. So now what the factor is there regarding this cervical and lumbar, because as you know, the cervical spine and lumbar spine, they are most mobile. Most mobile means in the morning, since night, 1,000 times neck movement we are doing, 1,000 times sitting and jogging, other thing. So these two are the most prone to develop. And the causes are the both. One is the lifestyle and other is the age induced is there. Lifestyle means what? See, every time nowadays, see, somebody will be sitting idle. What will happen? You will keep the phone and doing texting. This is called the texting neck syndrome. You know, this is texting neck. Doing like this, laptop like this. So brain weight, this weight is about 5 kg. And in the flexion position, this is giving about 7.5 kg of weight on your cervical vertebra. So most of the software guys, those who are working on this, they are all early onset degenerative cervical spondylitis are coming. All. I'm telling about yes. So this is one component. Other component is yes, how you are sitting, how you are, what the other activities there, how you work in the closed room. Your vitamin D3 is very, very low. Vitamin B12 will be low. You are smoking too much time. Your bone health is going down. So these all are the early onset. Degenerative is like my hair is graying, I'm aging. So everyone is aging. Same, the spine is also aging. So that problem will occur. But I'm much more concerned about the onset in the young populations.
Yeah.
This is the major concern.
Major problem.
Yes.
Also, sir, what do you think are the early red flags, sir, with regards to neck or back pain that we should never ignore?
Yeah. Early signs, see, one time everybody here, see, this is a body is like a machine. Anytime anybody will have neck pain, back pain, nothing. But this neck pain and back pain frequently occurring. What happens if you have severe neck stiffness or back stiffness, or sometimes this pain from your neck going to your hand, you feel some numbness like structure or current like in the hand or in the groin area or in the legs. Apart from this back pain, these are called early signs to look for. You have to consult your doctor or further things you have to do apart.
At the same time, please tell us how to typically start with medical management, sir. Matlab, what do you advise when do you advise moving towards surgery?
So we have to see decision making, or we call it as a treatment policy. It's all depends. Suppose I will give you an example. One patient is coming to me, any young patient, he told morning I get up with the right neck or severe torticollis or spasm of the neck. One day, no previous history. So why no investigation required, no MRI, no CT scan, just give some muscle relaxation for 2 days time and tell him to come back again, you will be there, right? But on other hand, when same guy is gone to the gym, he has lifted deadlift, okay, to show his girlfriend or somebody that I am doing this 50 kg, 100 kg, and suddenly he develops such a severe pain which is going to the leg and some amount of the deficit. In that cases, no medical management. He has to investigate, get the MRI and do the surgery as much. But I tell you, out of 20 or 10 patients, 8 patient is on medical management, required medical management is there, right? Medical management is medicines, muscle relaxant, some amount of the physiotherapy, and some amount, and surgery if required, yes, to get it as early as the possible.
So can you share how the outcomes differ when a surgery is delayed compared to timely surgical movement?
That's previously I told you, Hemant, brain and a spinal cord God has given only one time. Just one simple example. You are sleeping in the couch and this your hand nerve compressed. You will feel whole hand is numb. That is called SAT. And after 2 minutes time, you do like this. If this nerve compression is gone, you are free. You think that some nerve is compressed since last 3 years. What will happen? There will be changes inside the spinal, that nerve. So if it's delayed, that changes will not recover. So that's why it's not only the doctor's fault. Sometimes the delayed surgery also, patient is not ready, is creating not 100% recovery.
Yeah.
That is the more important thing.
Very, very important, sir.
Yes.
And also endoscopic spine surgery. Now that has become a game changer, right? Can you explain how it works and what makes it safer compared to the traditional open surgery?
Yes, traditional surgery we are changing. Last 2 decades, our Indian medical has changed, significant paradigm shift. And today we are as compare or par with any world hospital surgery.
Better, sir.
Better, yeah. Better, I will tell you why. Because in India, you can get it appointment of a senior 25 years neurosurgeon within 5 minutes time anywhere in the Hyderabad. You go on to the US, 6-month waiting time. The MRI cost is there about $6,000 is there. In India, how much? 5,000, 7,000 is there where we are. And we are providing the best healthcare services with everything. So we are much, much better. So that's why so much of the medical tourism is coming to the Hyderabad or any other. So same endoscopic is now the uppermost tier of this medical field in the spine surgery is there. You have smaller opening, no blood loss, wide vision, magnifications. So safety is much, much better for the surgeon and for the patients. Recovery, day care, morning you operate, evening will put the shoes and go home after within 3 days time, he will back to his normal life. Means normal life means whatever he was doing before, he will start doing his work. That is the endoscopic spine surgery.
Wow. Sir, in terms of recovery, blood loss, hospital stay, how do minimally invasive and endoscopic techniques benefit patients?
Blood loss is nil or minimal because it's a 6 millimeter. You might have seen any previous surgery. For one disc, they are giving about 10 centimeter incision, right? 10 centimeter, 12 before. So now it will move to how much? To put, this is the endoscope. So how much is there? 8 millimeter incision, millimeter. Okay, it will not visible. Some suture is also not required. We have to just put some subcutaneous incision. So minimal loss, blood loss, rapid recovery, and the patient is happy in the evening. Okay, and the same. Our aim is what? Any surgery, safe and back to life as early as possible.
Wow. So when you say 10 centimeters, it reminds me of that ruler we had in school.
Yes, same. Still, you can find out if your friend will meet him and tell if he is operated before 2010 or 5, you'll see how big this scar will be there. Okay?
Sir, can you share a story of some case where a patient's life got transformed because of this approach?
True. Yeah. One story, because I'm still enjoying his fruits. I was working right from Delhi. I shifted to the Vizag. I just not telling Vizag. I came to Vizag. I was not knowing from Delhi where, but I came to Vizag and find out, what such a beautiful place. I joined some hospital there, and start working in a hospital, bigger hospital. One day, one patient from Tuni area, so he was, his brother brought to the patient to the KGS hospital, and they declared he is gone, nothing will be happen, take to the patient back to his brother. So they are shifting the patient because nothing is like dead. So in meanwhile, my hospital came and somebody advised to go and talk to this doctor. He having the brain hemorrhage due to the aneurysm rupture. So night I operated. I don't know. I told him very few chances of recover. Surprisingly, that patient improved. Within 7 days time, he was ventilated, came out, discharged, and till now, it's a 2006. He is sending me mango from Tuni during COVID time also. Every year I'm receiving this. That is the story.
Wow. No, it's literally you're enjoying the fruits.
Yeah, absolutely. And now on my name, he has just demarcated 1 or 2 tree. So this tree, from that tree, all fruits come to my house, either pickle or this is the story.
Nice.
And this what we earned, this we earned. This is called money is nothing.
Also, that every summer I should come and meet you.
Yeah. Hemant, most welcome. I mean, yeah, I'm nice talking to you. And before I have seen you coming here, many of your podcast. So we are talking to the patient benefit also and some personal benefits
Correct.
also. That will be all.
Sir, also, these generally, sir, the feeling is when you say stroke aa gaya. Stroke means it's about for old people only. That's like a general understanding.
True.
But now we are seeing in young people also. Why is this happening, sir?
Yes, that's why I'm here. Stroke means very true. Old age, stroke ho gaya, stroke hua. But nowadays, you see, every time, every monthly, you can see somebody is going to the gym, he died. Okay, suddenly.
I saw one video, badminton khel raha hai, he fell.
Kyun? But he was not investigated. Is he died due to the cardiac stroke or brain stroke? Everybody thinks heart is culprit because we are not finding what is the cause. But I can say, Hemant, only one thing: vessels, artery of heart, artery of the brain, all are the same. And the culprit things which is getting problem to the heart is the same thing getting to the brain.
Correct.
So heart attack we call is a brain attack in young. Why? Because there is a lot of changes in the lifestyles are there. Lot of. We have some time, and only one factor for me is the biggest is called stress. Stress is mother of all diseases. Early onset diabetes, early onset hypertension, or anxiety disorders, your depressions, and all can lead to the hyperlipidemia, increased lipids, or this early stroke, either cardiac or brain strokes. So
First, we have to deal with the mother of stress.
yes,
Called stress.
Absolutely. Work-life balance is very, very important. Anyone, either it's a 30 years age group, 40 year age group is there, either in IT industry or medical or any industry is there. They have to learn how to enjoy. Enjoy means you do something.
Sir, tell me in your experience, how do you manage the work-life balance, sir?
See, my principle is very, very simple. After every 1 week or 10 days, if I feel I'm a little exhausted, I do what I like more.
Which is?
Like means like most.
Okay.
I call as there are happy hormones. You know happy hormones? Endorphin, serotonin, oxytocin. And how it's developed? It's developed just by bullsitting with the friends also, having chatting, traveling, whatever. Who give you kick from inside, right? Why the people go to the drug addictions? Because they give kicks and they become addicted, right? You can get this addiction from something good things also. Somebody plays, somebody sings, somebody go to the traveling. So out of every 3 months time, get about 4 days of time for personal, right? Family, okay, if you have everything, but I'm talking about personal. I may be Dr. Randhir, I may be a neurosurgeon here, I may be husband and maybe of father, but I don't want to spoil Dr. Randhir which is inside me. I want to enjoy that Randhir. I always do that.
Sir, come now, we'll have a deal, sir. Yeah. Every 3 months, both of us.
Bilkul. Yes, we are doing. We have a travel group. Right from we take car from here, we go to the Leh, Ladakh, Himalaya, every 3 monthly, 4 monthly.
Sir, both of us will go to Bidar and come.
Come?
Isaka.
True, sir. बिल्कुल सही बता रहा हूँ आपको हर एक चीज वैसे जिसमें आपको चेहरे पे स्माइल आ जाए मैं बताऊं एक दिन में अगर आपने 2 लोगों को स्माइल आया दैट योर एंडोर्फिन हैज इंक्रीज्ड एंड दिस एंडोर्फिन is regulator of all this problem is there.
Nice.
Or regulator, simple things. This is not too much medicine or that. No, absolutely not required.
दिल खोल के हंसो।
दिल बस कुछ भी ऐसा करो जिसमें आपको दूसरे को भी हंसी आए और आप भी एंजॉय एक दिन ऐसा लगे कि आज तुम आप you will feel you have something if you have the good hormone you feel that you have something in the evening you feel your mind is relaxed you are happy you did something good is there and that who is causing that happy hormone is causing this
सर मैं तो रोज अपने आप को जाके मिरर में देख के इतना हंसता हूँ सर
सही बिल्कुल वही बोल रहा हूँ क्यों नहीं हर एक चीज का अरे कुछ तो ऐसे हम लोगों को क्या बिहार में गाल मतलब थोड़े से इसमें
नहीं बोलो मजा आएगा
सोफिस्टिकेटेड तो मैं किनारे जाके कभी कभी जो है ना अपने
अंदर का बड़ास निकाल
निकाल दिया बस ठीक है. So, कोई भी ऐसी चीज जो आपको अच्छा लगता है. और सेकंड थिंग्स, इफ यू फील लाइफ इज बिकमिंग मोनोटोनस, जस्ट गिव इट द ब्रेक. Right time to give a break. You do something. See, money will come and go.
Sir, last time I gave a break, my boss lost his job. इतना बड़ा ब्रेक नहीं आप बोल रहे हो.
नहीं, कुछ भी इतना तो जरूरी है अपने लिए भी. कोई भी किसी का ब्रेक मीन्स इन व्हाट वे, किसी कोई जरूरी नहीं है कि हम टाइमली यहाँ से, शॉर्ट ड्यूरेशन भी हो सकता है अकॉर्डिंग.
नेक्स्ट टाइम यू कम टू माय शो सर.
यस, बिल्कुल.
वी लव.
टाइम जरूरी है ना. हमें देखो क्या है, हमें फैमिली भी देखना है, पैसे भी चाहिए हमें, ठीक है. हमें हमारी फाइनेंशियल कंस्ट्रेंट्स भी देखनी है.
लेह लद्दाख जाना है.
हाँ, लेह लद्दाख भी जाना है. ट्रू. तो वो अभी कभी वहां से लौट के आओ तो ऐसा लगेगा कि यस समथिंग इज देयर. तो कुछ समय के बाद तो करते रहना चाहिए बस.
मजा आ रहा है. सर, ऑन द अदर साइड,
Yeah.
आई एम श्योर everybody gives out warning signals.
Yes.
What are those signals that we should be aware of, sir?
Yeah. So I'm talking about stroke and young stroke. Any stroke symptom, we are now, see, since last 10 years, I'm in India doing the public awareness. We called as a fast. Fast means what? F for face. Whenever there is the deviation of the face to one side. A for arm. If you feel that in the morning time you are feeling tinglings or weakness in the hand. Speech. If you have sudden onset, you think that speech is not good or your speech is sedations, then T is the time. Time means run fast because time is the brain. Every second of the stroke, about every minute, about 6 million neurons are dying. That's why we tell fast time. This is called the brain is the time. Signals will be there. Very simple. Face, arm, speech is time. And you have to reach to the stroke ready hospital, not spend your time in a smaller nursing home. What will happen? Because we'll feel that if the treatment is started early, your result will be much better.
Okay,
Yeah. Fast.
Right.
Okay,
Sir,
but-
the last segment is called the rapid care. One word you have to answer, sir. First one. One word that describes your surgical philosophy.
Do not harm.
Do not harm. Right. Cervical or lumbar spine, more challenging to treat.
Both are challenging. Experience needs matters.
Biggest myth about spine surgery?
That it's causes problem. Okay, safe spine surgery is the safe, and when it's required, early is the better.
Early, sir. A surgical tool or technology you can't live without.
I can live without any tools, but most important things is there need upgradations every time.
Right.
Upgrade.
Young brain stroke, your one-line advice to the youth?
Same. Work-life balance.
Discipline.
Disciplined life is there. Do some exercises. Quit smoking if you can. And important, stress level management. Dhyanam, yoga, and your absolutely mental health.
Sir, finally, last one, finish the sentence. Safe spine surgery means?
Whenever that patient come to your clinic smiling.
Oh. Sir, with you, I think everybody will be always smiling. You are like a master. Thank you so much, doctor. This is one of the most happiest interviews that I have done.